Our topic is food deserts.
By Shelby Ankerfelt.
And Horor.
And Emily LaMott. What is a food desert? The term food desert was introduced in the early 1990s in Western Scotland. It is defined as an impoverished area where residents lack access to healthy foods. Any supermarket that is further than a mile away from its residents, making it very difficult for them to access to fresh, healthy, and affordable food. Where are food deserts found? Food deserts may exist in rural or urban areas and are associated with complex geographic and socioeconomic factors, meaning they are in areas of colored people combined with low income, as well as people with poor diet and health disorders such as obesity. Part of this may be because people who own grocery stores and such don't want to put their business in a community of low-income people because business would not be as beneficial as it would be in higher income areas. The blue graph shows low-income households, with the dark blue areas having 80% or more of the households being low income, and the white areas less than 15% are low income. The pink, orange, and green graph shows obesity, car-free households, and diabetes, respectively.
This graph shows no cars and no supermarket stores within a mile. The tan has no data available, and the dark brown is greater than 10% of that area has no car, no supermarket store at all within a mile. Who do food deserts affect? There are three main areas: minority central, evangelical epicenters, and service centers. There is the percent of food deserts in minority central is 5.9. Percent of food deserts in evangelical epicenters is 4.2, and percent of food deserts in service centers are 3.6. The coinciding obesity and diabetes percents are as follows in minority central: 32.6, 12.2. Evangelical epicenters is 29.8 and 11.0. Service centers are 28.7 and 9.8. Low-income populations are usually and almost always minorities and are the ones that are most likely to be affected by food deserts.
What are the health disparities? The study of food deserts has drawn attention to disparities in food availability, diet, and health that are associated with income level, ethnicity, and local food environment. For example, in several U.S. states, including Maryland, Minnesota, Mississippi, and North Carolina, wealthy neighborhoods were found to have more supermarkets than poor neighborhoods. And the same was true for predominantly white versus predominantly black neighborhoods. This chart shows the death rates caused by food desert between lower income and higher income households. Low-income households have higher premature heart disease deaths and premature diabetes deaths. This is because high-income households make more money, which gives access to better healthcare and healthcare options. Health implications. One serious health consequences of living in food deserts is obesity. Without ready access to nutritious food, people living in food deserts often have diets that are high in calories but low in nutritional value. To address this public health concern, the Institute of Medicine has published several reports that examine how we can limit the obesity epidemic in the United States. Food starvation has many negative health effects, including one of the main causes of cardiovascular disease is a diet high in unhealthy fats and low-density lipoprotein, cholesterol. One study of Chicago neighborhoods found the death rate from diabetes in food deserts to be twice that of areas offering access to grocery stores, while another conducted in California found that adults ages 50 and over from black and brown communities had double diabetes rate of whites from the same age demographic.
What are people doing to help others in food areas? There are things called grocery incubators, which increase the number of grocery stores or markets in a certain area. An example of people doing this is in Detroit. There are healthy corner stores which give more nutritious food options, which in turn helps with lowering obesity rates in low-income areas. There's also food education. One example of this is Michelle Obama's Let's Move campaign. There's also farm-to-school programs where almost 20 million low-income children get free or low-cost lunches through the school systems. Farmers market coupon programs are also an option. One example of this is Wholesome Waves Double Value Coupon Program, where people get double the value of food through the coupon program they have. Another is urban farms and food pantries. Most of the time, food pantries have processed foods, but these have fruits and veggies mostly, which are healthier for people.
What to do if you live in a food desert? You can educate the poor communities regarding food deserts, which encourages them to decide and find out many other alternatives. The poor communities can decide on ways to improve their living standards by forming a coalition against food deserts. It is also important to bring your ideas and concerns to policymakers, city council makers, and state legislators, among others.
So, how does this relate to gender and women's studies? Intersectionality is one way, and intersectionality is the theory of power, which is a way of looking at how power works in a complex way. It is also a mode of analysis, a way of looking at how the different facets of our identity work together. Food deserts mainly affect those in low-income areas, which are often times are minorities. This is considered an intersectionality as it gives power to those who are not affected by food deserts, whites and high income people. People who have higher income often lead healthier and nicer lives than those of low income, and this causes health issues, obviously economic issues, and more. And this is our bibliography.